The Minister of Health and Family Welfare and of the Agriculture Department of the Government of Meghalaya, Dr. M Ampareen Lyngdoh, while in conversation with reporters on the 22nd of August 2023, had given an insight into the government's intended 5-year plan or roadmap whereby legislators will be involved in mentoring and guiding key departments like health and agriculture to enable greater and better development of the state in general.
You see, these review meetings are very important. In all these departments which are based on communities, the social departments like health and agriculture, you just have to make sure that everything that is being planned and executed by departments are also understood by the MLAs. MLAs are participating actively. MLAs are helping government to monitor. MLAs are very resourceful individuals, and very often they will be a very important guide for a complete 5-year plan on behalf of the government. So we had very fruitful interactions. Most of the MLAs, most of the time don't even meet with their medical officers. So yesterday we had this meeting. It was a common platform between the legislators, the officials and the people on the ground. And we took many decisions that were going to be pro-people. We made sure that MLAs are in touch with their medical officers with regard to infrastructure building. MLAs should be put on the loop for ensuring that adequate medicines are available at their health facility centers. MLAs should also be from time to time informed about the progress, the work done in their respective health centers, health facilities. So it was very fruitful. Then we also had a second meeting. It was a full day conference with MLAs. Second meeting we sat with the Agriculture Department. We appraised MLAs of various schemes, government plans, government programs, and progress of various projects. So very fruitful meeting, and I for one give my sincerest thanks to all the MLAs who have come to that meeting. I have almost completed my entire tour in the entire state. I finished Garo Hills, I finished Jaipur Hills, I finished Khasi Hills. Now I'm going to go to Ribhoi district. I finished West Khasi Hills. So I've covered the entire state to understand the difficulties, the challenges, the expectations of legislators in as far as the provision of adequate health facilities, also providing enough opportunity for citizens to opt for agriculture as a lucrative employment option. So these are things which we need to do, and I'm so happy that wherever I have gone, there has been a keen response. Tomorrow is my last leg of tour where I will go and complete my entire all-state tour with the Ribhoi MLAs. I'll be sitting with the Ribhoi MLAs tomorrow. Hopefully we will also have some very fruitful discussions and debates. And I hope that after all of this, I will sit with all of this information. Then I will plan a roadmap of what are the priorities for the Department of Health, what are the priorities for the Department of Agriculture in the coming 5 years of this new term.
On the high maternity mortality rate and infant mortality rate in Meghalaya, Dr. M Ampareen Lyngdoh said that one of the solutions to prevent untimely death of pregnant mothers and newborn infants would be to involve community or traditional heads in educating and guiding families, especially in the rural areas, to avail of health facilities that have and will be set up in respective villages so as to enable timely treatment and other health benefits for pregnant mothers and their babies.
We have seen during crisis times like the COVID that it is the health, it is the community leaders that actually contain health hazards for the people of the state of Meghalaya. So we will utilize these systems which are inherently there in the state, and we will allow community leaders to also help in ensuring that quality health is given to citizens of the state of Meghalaya. For example, why is the MMR and IMR rate so high in the state of Meghalaya? First thing is that hesitancy for institutional deliveries. But I'm very sure that if our community leaders can help us with these local DIEs, as we call them, these local birth providers, I think we will be able to do much better. I wish we would have centers in every 10 to 25 villages, where at least if a mother is hesitant to come for whatever cultural belief, social belief, mental peace of mind, at least mother should have a safe place for the child. And if we can have babies protected, many of our newborns are succumbing to issues which are related to birth. The child is born, child is not resuscitated on time, child develops a big pneumonia, from what I understand as a layman. Now this is something which should not have happened. We have delayed deliveries because of complicated pregnancies, high-risk pregnancies. Now these mothers don't even know the risk they put themselves at, the risk they put their children at. So with the ASHAs and the different workers of the health department, if we can have a convergence. Right now everybody is doing things differently. So we need to converge. And MLAs are the key in all of this convergence plan.
The Minister of Health and Family Welfare Department, Dr. M Ampareen Lyngdoh, had informed on the setting up of the sub-divisional health centers in strategic locations within each district of the state in order to ensure reduction of wastage of funds by citizens and also to ensure availability of quality health amongst individuals.
We are short by health centers. Health centers are like dispensaries. They are like smaller versions of a PHC, and of course the biggest version is the CHC, and then now we are also instituting what we call them the sub-divisional hospitals. These are all the tertiary care centers of the state. How do you connect? A pregnant woman all the way from Ranikot ideally should not come all the way to Shillong for a medical treatment that is vital for safe birth of the mother. So now we are looking at Moklang being one of the FRUs for pregnant mothers. And we will have these kind of facilities. We will have a web of facilities so that we reduce the intake and the wastage of funds by citizens. If we can get there and convince a citizen of a certain region to remain within that region to get all the help they want, then I think we would have walked that extra mile that is so needed in the health system in the state of Meghalaya.